Welcome to IVF Success Secrets. What you should know about IVF before your next circle. Organized by Procare Hospital, Abuja. I'm your host, Ramona Selim, and with me today is Dr. Fache Moses. On today's episode, we're looking at choosing the right IVF clinic. Why that matters more than anything you think. Dr. Fache, you're welcome.
Thank you, Ramona. Once again, it's a pleasure for me to be here. And I'm happy to walk with you through this episode. Thank you.
All IVF clinics say they offer advanced care. How can someone choose the right one?
All right, that's a great question. Many clinics use buzzwords like advanced care, cutting edge technology, but I usually recommend that patients look beyond the marketing. And so choosing the right clinic is a very critical decision in your IVF journey because it makes the difference between a successful treatment and a failed treatment. Patients should look out for transparency, they should look out for personalization, and above all, they should look out for results. You should look out for clinics that have good reputation. Don't just fall for the marketing. Nobody demarkets his own business. So you should ask about the clinic, make your research, do your homework, find out, patients they've treated, what are their results saying. So that is what patients should do in choosing the right clinic for their IVF treatment.
You've already answered my second question, so I'll move to the next thing I have in mind. Why is the lab such a big deal in IVF?
So you remember in our previous conversation, I told you that IVF, after the egg is extracted from the woman and the man's semen is collected, is done in a controlled lab environment. And this lab is what simulates the human body. You're trying to deceive the egg and the sperm as if though they are still inside the human body. And so it is essential for the lab to be top-notch. That is the heart of IVF treatment. Without a good lab, then a clinic cannot be optimal. So what kind of incubators the lab uses, the expertise and skill of the embryologist, the medical doctors and nurses is very important. So how the environment of the lab is maintained, it's important. And of course, you want to look at what level of standard does this lab have. Our lab, for instance, is ISO certified, means that it has the standard is quite high. When you get to a level where you feel that, okay, you need to audit what you're doing, and then you call people from come and assess our systems. And so I'm happy to say that we have a lab that is ISO certified, meaning that it's operating at a high international standard. So these are some of the things you look out for in choosing your clinic. You should ensure that they are able to handle advanced cases, because beyond the regular traditional IVF of mixed sperm and egg, there are other aspects of IVF. So you should be able to know they also offer advanced diagnostics, like we talk about evaluation and being able to make a diagnosis. If you haven't chosen a clinic that can actually diagnose your condition because they don't have the means to evaluate it, then you might be in the wrong place. So the lab is simply the heart of the IVF treatment. That is where fertilization happens. That is where embryo culture, meaning that when fertilization has occurred, the embryo is cultured for up to 3 to 5 days before they are transferred. So it's just very important that the lab of an IVF center is top-notch.
I have a follow-up question on that. How can one who is thinking of venturing into IVF or for IVF know exactly that kind of top-notch clinic? Is there like a rating somewhere? Are there names that have been itemized saying this hospital has this hospital has this already? How can one from the outside know?
Unfortunately, it's not very easy to find such ratings anywhere. There are countries that have like database where you can go and look at how fertility hospitals are performing. That is not yet very available in Nigeria. And most of the time, patients will rely on, word of mouth. And then what they are able to get from the clinic themselves, what their results are saying. There is a body in Nigeria that organizes the fertility hospital, what we call it AFRH, that's Association for Fertility and Reproductive Health Specialists. So AFRH is also in that line. So members of this association, as much as possible, do try to abide by international ethics and standards. Yeah, so being a member hospital, they tend to, the hospital, apart from individual fertility specialist membership, hospitals are also members of the organization. So it's one of the things that you can also look out for. And I just talked about ISO certification, which goes to, okay, a certifying body have come to look at the processes of the hospital. They've looked at their standard and certified them of international standards. So those are some of the things you can look out for. Because reputation matters a lot. What are the patients saying? So not just what the clinic are saying about themselves, but what are the, people who have used them, what are they saying about them?
Is there such a thing as bad protocol for IVF?
All right, so it takes us quickly to say that I have mentioned earlier that IVF is individualized. It is also personalized. So what that means is, what the protocols means is, one of the key process in IVF is stimulation. I'm sure we'll be talking about that. Which means encouraging the body now through the ovary to produce more eggs rather than just the one that is meant to be produced naturally. So the protocols are, variable. We have what we call the antagonist protocol, the agonist protocol. This is how you mix and match medication to be able to stimulate the ovary. And so by the time you evaluate patients and you make their diagnosis, you will find which of these protocols are appropriate. One of the things that come quickly to mind is if you have someone who have PCOS, that's polycystic ovary syndrome, they are prone to having what we call ovarian hyperstimulation syndrome. They tend to overreact because they have a lot of follicles. And when they develop this complication, sometimes it can be critical, sometimes it can be fatal. So you would need to decide, okay, because this patient had PCOS, I'm going to use an antagonist protocol so as to avoid or minimize the risk of developing this ovarian hyperstimulation. The dosage of medication that you're going to use would also vary. You cannot carry that same protocol, hook, line, and sinker, to someone who has a diminished ovarian reserve, because you're not going to get good response. We're not saying that. That's not to say you cannot use antagonist protocol, for instance, for someone with diminished ovarian reserve, but the dosage of medication will vary. The nuances in how you go about how long do you have to give the medication would vary. Okay, so so in that situation now, talking about bad protocol, it is not the protocol that is bad, but it is the application of the protocol in the wrong circumstance. So you would say that, okay, because you use the wrong protocol, the patient may not respond optimally.
In your opinion, should patients be asking for success rates? And How do they interpret that?
All right. Thank you. It is a good approach for patients to want to have an idea of success rates of the hospital, because that usually is one of the few parameters they have to evaluate the expertise of the hospital. However, what happens in reality is that these percentages are just dished out without context. You hear hospitals telling patients success rate is 80%, success rate is 101%, everybody who comes get pregnant. But in reality, success rate without context is deceptive. It encourages unrealistic expectation. If I were to be a 42-year-old woman who goes into a hospital and say, oh, our success rate is 80%, are you apparently saying that as a 42-year-old woman, I have 80% chance of success in my first cycle? So that obviously is not correct. Are you saying, for instance, that if I don't have eggs in my ovaries, or have very few eggs, I still have up to 80% chance of success in my first cycle? So we want people to be able to understand what success means and in what context is that success applicable. So people should ask more about what is your success rate in my age group? What is your success rate in my kind of condition? Do you handle my situation? How many people with my situation have you treated in the past 1 or 2 years? How many of them succeeded? How many cycles do they have to run for them to succeed? These are the questions that will matter more rather than just being excited that a hospital has 80%. That 80% may not be applicable to you. So we, as much as this is a question that most clients are encouraged to ask, the interpretation can be very dicey. And so patients should look beyond quoted rates for success rate when the context is not there. If you go to a hospital that gives you success rate and did not apply your age to it, that does not stratify their success rate in relation to age. And then does not stratify it to say, okay, in these people, in this category of people, then you should, that's a red flag. They are not telling you the truth, they are not transparent. So you need to be able to ask this question. Are you saying that this 65% is applicable to me, whose husband has a very severe sperm abnormality? So these are questions that clients should ask. And so they should understand what success rate really means. This success that we are counting, is this success of how many people deliver their baby? Or is this success of how many people they saw the babies on ultrasound at 7 weeks? Or is it success about how many people who tested positive using a urine or blood test? So these are the things. What is the end point? What does this success actually mean? You need to know. So if a hospital, who sees older people quote their success as 40%, it might be better than hospital that says, oh, we are not seeing anybody who is above 35. We cannot see. Because in that case, they are just, somebody says, oh, we have 80%, but they might be quoting success rate for their 25-year-old and less. So we need to ask this question and understand, doctor, this success rate you have quoted, is it applicable to me as a patient? Is it applicable considering my endometriosis, for instance? How does this success figure relate to me?
Then moving on to the support system, what are the support systems needed for someone going for IVF?
IVF is an emotionally draining, mentally challenging treatment, and psychological support is very, very key. Transparency is key. Having someone who takes you through the process, gives you clear answers, give you realistic expectation is very important towards maintaining good mental state and emotional state, which of course eventually affects your treatment. If you are not mentally stable, you are not emotional. If you are stressed, this stress would disrupt your hormones. And these hormones in turn can affect the IVF processes, especially implantation. So if patients have not prepared well and do not have realistic expectation, they get too anxious through the processes, and at the end of the day, they might not succeed, not because the process itself was faulty, but because of what the way their body have mismanaged, the hormones because of their mental and emotional state. So having all those support, somebody who takes you through the treatment, somebody who is able to hold your hand through difficult times, somebody who is able to give you hope, realistic hope now, not false hope. Those are very important. So psychological support is key, nutritional support is key, medical support is key, nursing support is key.
Thank you so much, Dr. Fache, for your insights.
Thank you, Ramona.
On this episode, we have looked at the red flags to look at. We have looked at the psychological and the emotional support needed. We've looked also at the nursing support one needs when undergoing an IVF treatment. Watch out for episode 4, which is Inside the IVF Lab, where we'll be looking at stimulation to embryo creation. Thank you for watching. Thank you for listening.